Well, ladies and gentlemen, a very warm welcome to the special eCancer series on cancer conflict in Ukraine. My name is Richard Sullivan from King's College London and from the eCancer trustees. And it's a great pleasure to welcome back to eCancer to talk to us a little bit this morning, Kathy Oliver, who's the chair and founding co-director of the International Brain Tumour Alliance. Kathy, thank you so much for being with us today to talk a little bit about what's been going on since we last actually spoke in June last year. Of course, we're 10 days away from the anniversary, sadly, of 1 year in from the Russian invasion of Ukraine. We're coming out at the end of winter at the moment. There's no end in sight. There's been enormous fighting and activity in the eastern areas, and of course, a tremendous amount of stress and strain on Ukrainian cancer services and also patient organizations and hosting countries since we last spoke, Kathy. Kathy, give us a sense of what you've been seeing since June last year, both from your own patient organization and what you've been hearing from other organizations more generally.
Okay, well, thank you, Richard, and it's good to be back here talking with you again and kind of measuring what's happened in the last 6 months. I think none of us really thought, together with the rest of the world, that this would be going on for a whole year. I mean, it's just incredible, and it's really been a horrific experience for the refugees that we have been dealing with. And I think we, despite the fact that you said there is no end in sight right at the moment, we do need to be planning for that end at some stage. And perhaps we can talk about that in a minute. But what we have noticed as a patient organization is that there has been a fall off in the number of brain tumor patients in particular who have come to us to seek help, or rehousing or transportation, to a safe country or whatever. Um, we did hear from a woman recently, a couple of weeks ago, who or her son, and they were desperate to leave to obtain better medical treatment abroad for the mother's brain tumor. Sadly, she couldn't get her documents in order, her passport in order in time, and she died in the process of doing that. But generally, we have seen a fall off. And I don't know if there will be another wave as the spring approaches, but we need to be prepared if there is. And I think we will be. As patient organizations, we've set up systems and networks and everything else. So should there be another wave, I think that we're prepared.
And we, of course, we were aware after June last year that there was a lot more reorganization by the Ukrainian Ministry of Health to try and address the issues of treating cancer patients within Ukraine. And you mentioned there, of course, the fall off in the numbers of patients you've been hearing from and actually seeing. Do you get a sense that's because the care has been sort of re-established within Ukraine, or has it just been a weather-dependent factor? Because obviously the winters there are bitter. It's been much harder to cross borders and move across. What are you hearing from other patient organizations as well? Are they seeing similar things?
Yes, I mean, I haven't heard a lot about the specifics that you mention. It's very hard to measure what is the cause of this fall off, and I think ultimately it's a combination of the factors that you mention. You could also say that the people who contacted us were the ones who were, able to get out, able to travel from parts of the country where there still was an open corridor, leaving now the people who are really in desperate situations but just cannot get out. But there is no, unfortunately, there's no way of measuring what the actual causes are. I guess because things are so chaotic over there, in many parts of the country, we just don't have that data.
Right. No, that's an extremely important point. Maybe we'll pick up on the intelligence and the data towards the end of this discussion. I want to pick up on something you mentioned last time in your interview in June, which is the importance of planning, of preparation, as you put it. The failure for preparedness to deal with the permanency, which was a wonderful phrase here. And you mentioned just then a moment ago about how on earth we're going to plan for mitigating over the next few months, but also for a future when health systems and cancer systems within Ukraine will need to be re-strengthened. What's your sense of where we're at the moment?
Well, I'm encouraged to see that plans are being laid down for supporting Ukraine and specifically cancer patients and healthcare professionals after the war ends. And there are some examples of that. I mean, some of the EU funded programs, the research programs, the training programs are now incorporating special work packages aimed at Ukraine so that healthcare professionals will be supported in any advanced training they want or rebuilding or whatever. And I think there are great opportunities to do that for lots of projects, to build in a special work package or whatever focused on Ukrainian cancer patients or healthcare professionals. So that is encouraging. But I think that there are other aspects to the rebuilding of Ukrainian cancer patient situation and healthcare professional situation. I think for one thing, we have to look at what is going to happen to the thousands of cancer patients who have left Ukraine and are settled now in other countries. Will they remain in those countries? Will they go back? How will their treatments pick up from what they've had in other countries to what they can then get in Ukraine if they choose to go back? And we mustn't forget the psychosocial aspects of all of this, which I think I also mentioned in the last interview. You know, you function on adrenaline sometimes when you are faced with terrible situations. And when the situation resolves and the adrenaline subsides, you're faced with the reality of the hell and the horror that you have been through as an individual. So we mustn't forget that we have to build up strong psychosocial services and continue to offer those to any patients who return to Ukraine from abroad when the hostilities are over with and peace returns. It's also within the realm of possibility, of course, that cancer patient advocacy groups can play a special role in the rebuilding of Ukraine, because there are some amazing patient organizations there already working on the ground who we are all in touch with. And we very much want to support their efforts, not just during this period of conflict, but afterwards in the rebuilding, to partner with patient advocacy organizations and make sure they get all the support they need. And in fact, you know that President Zelensky was here in the UK yesterday and addressed both houses of the UK Parliament. And he said something which I really hit a soft spot with me. He said, bravery takes you through the most unimaginable hardships to finally reward you with victory. And I think there's no greater tribute that we in the European cancer patient and healthcare professional community can give to Ukraine, but to echo those sentiments, you know, and to be brave ourselves and to be bold in whatever we can do to support Ukraine.
That's a marvelous place to end, because I think you're absolutely spot on the importance of rebuilding both physical and mental health services. And also, as you said, for actually the planning forward. And I think that's something we're hearing from many people at the moment, is the importance of strategically planning a properly funded plan. Already the Ministry of Health in Ukraine, we know, is going to be launching a national cancer control plan at the moment, which is being endorsed at the highest level. But I think really this is a collective action, and as you said, involving the EU Cancer Mission as well, and bringing Ukraine into the wider European effort. So Kathy Oliver from the International Brain Tumour Alliance, thank you very much indeed for joining eCancer today. Very grateful to have you here, and thank you again for all the wonderful work you're doing. We look forward to catching up with you again very soon to see how things are progressing. Thank you.